I'm Dana Raml. I'm originally from Lincoln, born and raised, and then I went to the University of Nebraska-Lincoln, so I stuck around there. I moved up to Omaha following my undergrad education to start my med school training at the University of Nebraska Medical Center. And then loved Omaha so much, I stayed here for residency training as well. Really, medicine and psychiatry in particular really called to me because I loved the interplay with the biologic aspect in addition to the opportunity to do therapy and some of those treatments. So I just felt like psychiatry was a great avenue where I could really work with patients and tackle the problems that they presented with from all different angles. When I first meet a patient, I want to make sure they feel comfortable. I know there's a lot of anticipation. I think particularly coming to a psychiatrist, that many other specialties of medicine patients don't have that and same sort of anxiety about coming in. So I just always want to reassure folks that it's just like any other doctor's visit. Check in, we have great receptionists. We'll get your vitals and then come back and talk to me. The first visit, I really want to get to know who you are, what brought you in today, and how all those different facets of what makes you you can be incorporated into a really comprehensive treatment plan. So a lot of the diagnoses that we're tackling as psychiatrists are really multifaceted. So we need to have a multifaceted treatment approach, and that first visit is really figuring out what are the different steps that we can take to help improve that patient's life. So I love, as I mentioned earlier, I love being out in Omaha, the different restaurants and food scene I'm really into. My husband and I have a great big garden, so we're always trying new recipes and growing new vegetables and fruits to try, jam making and such like that. Also, I love being active, really enjoy running and biking, using the Omaha Trail system. And so those are some things that I like to do when I'm not busy at work. I really got interested in academic medicine from a great mentor that I had as a medical student. And he encouraged me to go to a psychiatric educational conference. And I just had a great time, really enjoyed it. And that really got me thinking that academic medicine would be for me. And I love the collaborative aspect that academic medicine brings to the table. You have to stay up to date on things. It's a really strong team approach, and just the continuation of having that mentorship so that I know I can continue to provide the best care for my patients.